Hello and welcome to the Parks Trust and OU podcast. Today I'm joined by Dr. Jitka Vseteckova, Senior Lecturer in Health and Social Care at the Open University, Dr. Yoseph Araya, Senior Lecturer in Ecology and Environmental Sciences at the Open University, and Sonal Mehta, who is a pharmacist by background and is the Voluntary and Community Partnership Lead at NHS BLMK Integrated Care Board. We are all joined by an enthusiasm for the health benefits of the great outdoors. Coming together, but from different disciplines, we're here to discuss how to engage with green social prescribing. The NHS defines green social prescribing as the practice of supporting people to engage in nature-based interventions and activities to improve their mental and physical health. And Sonal will tell us a bit more about this later. For now, I'm asking Jitka to tell us more about what happens as we age and why going outside and engaging with social and green social prescribing is good for us.
Hello, everyone, and thank you, Ellie. It's great to be here. It's really lovely to be in our usual circle of podcasting and supporting aging populations across the UK with Aging Well, especially bringing them outdoors and working together. So my name is Dr. Jitka Vseteckova, and I specialize in engaging members of the public with health and educational programs like the Aging Well Public Talk series and our new kind of public health campaign, Take 5 to Age Well, and explaining why they're so important for our aging well and why taking action is so important for us to age well. So according to the United Nations, aging is one of the most significant social transformations of the 21st century, as virtually every country in the world is experiencing more older people in their populations. Today in the UK, there are almost 11 million people aged 65 and over, which makes 19% of the total population. In 10 years' time, this will have increased to almost 13 million, which would be 22%. And as we know, we start aging the moment we're born. It demonstrates more significantly when we reach a certain age, and the usual benchmark is being 65 plus. But our aging starts much, much sooner, and the way it demonstrates when we are over 65 depends also very much on the decisions we have been making over our lifespan. Quite a large number of people, unfortunately, do not spend the longer years staying fit physically as well as cognitively, and they are not as healthy as they could be. And many people's experiences of aging is getting much worse the older they get, and yet it doesn't have to always be that way. So the question is, what can we do as individuals to take some control of our own aging and do all we can to stay well, keep well, and in turn age well? The 5 pillars of Aging Well is an innovative model that helps everyone to do just that, encouraging healthy aging behaviors in 5 key areas such as nutrition, hydration, physical, social, and cognitive stimulations. We have started years ago a series of podcasts on aging well and often mentioning these 5 now good old pillars. And over the years, we have discussed in these podcasts what aging brings about in quite a detail. So I will outline this just briefly today and link it with why the social and green prescribing are such a fantastic idea, especially when it's implemented well. Aging brings about changes in metabolic rate and muscles, liver, kidneys, and overall mobility, and of course our brain functions. With aging, naturally occurs muscle atrophy, which means that our muscles are decreasing in size or volume, and we may become and also feel weaker. Nutrition is therefore very important because nutrition is helping us keeping the muscles strong. And to keep our good health while we're getting older, we need to keep the blood regularly circulating. And here we're helped mainly with good hydration, drinking plenty, and regular physical activity. So our cognitive functions are also very important. And we need to help our brain to keep its plasticity, its function to grow capacity to learn for as long as we're able to. And brain, like muscles, really works better when it gets stimulated. So social stimulation and exercise enhance massively cognitive functions, and this is what the most recent research supports as well. If we want to stay in good physical and mental health for longer, we need to engage with things, places, people, the world around us as much as we can. Now, some links to the social green prescribing are already starting to shape physical activity, ideally outdoors, jointly with people, healthy snacking along the way. We clearly see the most of the pillars covered. So why hydration? All these age-related changes are even more prominent if we are dehydrated, and especially so if we take regular medications. If we're dehydrated, it very much impacts on how the medications we may be taking gets processed by our body and hugely affects the way we feel and go about our day. And Sonal will be able to tell us more about it today and also talk about the social green prescribing at its best.
Thanks very much, Jitka, for that comprehensive overview of the 5 pillars of aging. It's always really great to have that reminder. I want to start by saying that it's really important that if you're prescribed regular medication for a long-term condition, then please don't stop or change how you take that without discussing with your healthcare professional. What I'm keen to do is to provide you with a better understanding about the role of medicines alongside other interventions that are beneficial for your health and well-being. And this hopefully would enable you to hold more informed discussions with your healthcare professional about balancing the benefits and the risks, adverse effects, side effects, for example, of any particular option. Ideally, though, we would want to try and prevent the need for medication where possible, and I think that that's where an understanding of the 5 pillars of aging and the wider determinants of health can be really, really helpful. So, as I said, Yitka's covered the 5 pillars very well. So I want to explain a little bit more about the wider determinants of health. So these are a diverse range of social, economic, and environmental factors that can influence people's health and well-being. It can vary from access to good nutrition, clean water, strong social networks, good transport options, education skills, having a decent income, and also the natural and built environment around you. Each of these factors in isolation or in combination with each other can actually affect your ability as an individual to engage effectively with the 5 pillars of aging, and thereby affect preventing the onset of disease or reducing its progression if you have already developed a long-term condition. And this is where social prescribing and green social prescribing can be really beneficial. And in its broadest sense, social prescribing is about supporting people with some of the challenges related to wider determinants of health, and by providing that support with those sorts of issues, actually people then are in a better position to adopt the kind of behaviours that are good for improving their health and well-being. So, and this can range from, as I say, supporting people to access services that may help them with their with financial issues or relationship problems. It may be about upskilling and training, during your career to have a bit of a change in career. And then on the other side as well, it's around kind of discrimination and prejudice. So actually, if people, there may be certain groups in society that have maybe felt marginalised, and they have particular barriers to accessing services or engaging in particular activities. They may have lost trust in statutory services over time, and their confidence in public spaces can also be affected. So green social prescribing then is specifically about supporting people to access activities in green and blue spaces that can actually help with some of these types of issues. And actually, if it's planned really well, it has the potential to tackle many of the wider determinants in one go. So if we use the example of community gardens, they can bring people together socially. It can be a space to grow nutritious food and also engage in physical activity at the same time. And then other types of examples for green social prescribing could be about supporting people to engage in walking groups, or maybe conservation volunteering, citizen science type activities. So there's so many different things that people could get involved in terms of green social prescribing. And And I think organisations that that are responsible for these kinds for green and blue spaces are increasingly recognising the value of developing activities and programmes that that social prescribing that they can actually people can be referred to for social prescribing. And also thinking about planning these sorts of activities and programs so they've got inclusion and access needs in mind. So, we're in Milton Keynes, we're really fortunate to have the Parks Trust, and shortly Ellie's going to describe a little bit more about what the Parks Trust are doing to develop social prescribing activities for residents of Milton Keynes. But for now, I'm going to hand over to Yoseph.
Thank you, Sonal and Jitka. I mean, you have presented a very important aspect of that aging starts much earlier and that we should be acting on it. And of course, the health benefits of nature. I mean, this is well established, whether it is physical, emotional, or social, that the exertion we do helps build muscles, and it can also help mental well-being and also stress reduction. I mean, these have been advocated even if in indoor environments. So the restorative effects of nature are very important because lack of them has a definite and measurable negative impact, and it can hurt people, and it can also result in mood disorders compared to those who have access. Now, one of the benefits and most recently understood is that of nature for cognitive functioning. I mean, specifically, it points at improved engagement and learning being a key. So nature helps people by increasing attention, reducing stress levels, and also improving self-discipline and enjoyment. I mean, these are so well understood now that, as Sonal was saying, green prescribing has become part of the medical care, part of the health care, and is also recommended, for example, by the National Health Service, NHS. So it involves people to engage with activities outdoors. For example, it could be local walking schemes, whether it is organized by societies, by community groups, or whether it's individual, or whether it is group of friends. Then there is community gardens, which people can work on, or conservation volunteering, which is quite popular. In a way, it helps people feel engaged in their environment as well. Of course, the list is endless. Some have been named as green gyms as well, or open water swimming, or art and cultural activities. The key thing is that they engage people and occur outdoors. But of course, we must note that all these activities can be done without being prescribed. So it's so easily available that we shouldn't wait for it to be prescribed. But of course, as important as it is, we have to remember that there is a key stumbling block of accessing all this. Yes, it is easy to say that they are all around us and that we should get involved, but there are some that block society from harvesting these benefits. Generally, there is a broad term we use which calls this as nature disconnection. It is defined as a lack of awareness or disregard for human identity within non-material or nature environment. So basically, you can call it as lack of attention and lack of appreciation with our natural environment. But this is unfortunately prevalent because of few reasons. Obviously, there is a lack of access. That is one, which has a broad element, which had inequality and which we have tried to deal with in our previous podcasts, if you have been following us. But the other one is modern living. Things have become easy. There is no need to hunt and live and go outdoors or directly connect the food we eat or the environmental benefits we find with nature. I mean, there are some reasons for this. Partly, it could be the social cultural shifts. Well, now we are spending more time indoors and we don't have to go out. If you don't want to, even your delivery, your shopping can be brought to you. But also there are institutional arrangement as well, which can fail us. So a lot has been done, for example, encouraging people to go outdoors. For example, pupils to do a daily run or a daily activity outdoors. So there could be institutional failure on this one. And also sometimes there could be disregard of this just because maybe it's not considered important enough and there is lack of knowledge. So I think this requires a broader solution. I mean, we cannot say just one, but it needs to be done at government level, at civil society level and business, and also with a lot of arrangements to enhance the appreciation and engagement of nature and make it part of our living and just not the background furniture or tapestry. So, there could be possibilities to enable people to engage outdoors, whether it is as a daily activity or whether it is holding festivals outdoors, or whether it is putting some of our curriculum and school teaching outdoors. So there are a lot of ways we can do, and even community health groups getting together to work as well. So, I mean, the list is endless, and we can even have engagement by law as well, prescription that certain level of access to nature is part of the citywide planning or part of getting communities to engage as well. So there are many solutions, but there are many ways that contribute each, and there have been some very good examples. And it's at this point I would hand over to Ellie to tell us what our local parks trust is doing to help and make this green space benefit available to all. Over to you, Ellie.
Thank you, Yosef, and thank you to each of you actually for giving such a great scientific background to why green social prescribing is so good. It was really well explained. It's such an important thing, and I'm just here to explain how we're doing it on the ground, really. So, as a bit of background, the Parks Trust is a charity that cares for public parks in Milton Keynes, and engaging local people with the great outdoors is one of our core missions. And we're lucky to have dedicated teams for outdoor learning and events with practitioners who are ensuring that residents have opportunities to access the healing benefits of nature. We are lucky in Milton Keynes in that most residents live in less than a 20-minute walk from a green space. That's quite unusual in the UK, but it is a target that we're trying to reach more widely across the whole of the UK. But Milton Keynes was just designed in a way where that's possible. So it's a really amazing thing. So the Parks Trust, we've recently taken over a programme of health walks, and these are guided walks in parks around the city. It's actually a national programme, so you might have it in your local area if you have a look. Most people are signposted to health walks via their local GP surgery, or they could be through a community group. And now we have at least one walk going on each day of the week. So by walking and being outdoors, the participants of the health walks access the 5 ways to wellbeing, which are getting active, taking notice, learning something new, connecting with others, and giving time by supporting one another. So they're a really successful programme, and they're a great way to get to know a new park or just to visit a park time and again and notice some of the seasonal changes that take place there. Another great way locally to practice these 5 ways to wellbeing is actually by attending the 5 Ways Cafe at St Andrew's Church. Now, you might recall this from earlier podcasts. The 5 Ways Cafe has been running for a number of years as a dementia-friendly community cafe where you can grab a cuppa, have a friendly chat, take part in a craft activity, and also take part in a gentle guided walk. And the volunteers there are Alzheimer's Society Dementia Friends. They're all set up for anybody who comes in the door, but they also welcome new volunteers. So perhaps it could be a good way to give back to the community. Many of our outdoor learning activities at the Parks Trust facilitate elements of green social prescribing. So, for example, we run forest bathing workshops in our ancient woodlands, where you can practice mindfulness in nature. Forest bathing has been so successful in Japan, it's actually now been implemented as a national health programme, with participants continually studied to try and understand what is going on physiologically. But the great thing about something like forest bathing is that you don't actually need to join a session. You can find resources to practice forest bathing on your own, and you can find those on our website. You don't necessarily have to do it formally either. You can just be in the forest and just ask yourself to take better notice of what's around you and use all of your senses. There is a lot of research about gardening and working outdoors being good for your health and well-being. We think that we've talked a little bit about that today, but conservation volunteering is a really good one for your health and for your well-being. Each week, we have a group of volunteers who help us across the parks with conservation management tasks. So they are contributing to better habitats across the city. So the volunteers are amazing. They keep active all day, they chat together, they share their lunch, they learn new skills, and they're all giving back something to their community. And it's also a really huge help for us at the Parks Trust. We have over 200 active volunteers, and lots of them take part in conservation activities. These are, there's regular people who do volunteering all the time, but we also have more ad hoc volunteer opportunities throughout the year. We call these our community volunteering programs. So have a look out for those on our website, and also have a look for when we advertise volunteering roles. We usually advertise for something quite specific, but in your local area, you could contact your parish council about similar opportunities. So as prevention is better than a cure, don't wait for a doctor to do it. You can prescribe time outside to yourself. Look at our website, theparkstrust.com, for some inspiration, or you could grab our exciting What's On guide from locations around Milton Keynes for inspiration, and you can seek out volunteering and outdoor activities for yourself. Thank you so much for listening with us today. We'll be with you for our next podcast in very shortly.